Dr. Rondi Hagerman of the UC Davis Mind Institute started the National Fragile X Foundation in 1984. She was among the first to identify patients with this condition and saw a complete absence of information and support. So she connected with impacted families, raised seed money, and called upon her network of friends to help. Rondi's patients needed something more, so she took it upon herself to create an organization. The Fragile X Foundation spreads awareness, educates, and supports research toward better treatments and an eventual cure for all Fragile X-associated disorders. The goal of the National Fragile X Foundation is twofold: find a cure or targeted treatments, and support the community with everything they need until we get there. We do 6 things. First, we help coordinate 26 specialty clinics nationwide. The clinics advise on the latest and best care, advanced treatments, and educational strategies. Second, we connect those directly impacted with each other and with knowledgeable professionals. Third, we compile and update a comprehensive library of materials. Fourth, we advocate for increased federal spending for new drug therapies and support services. Fifth, we foster collaboration to accelerate scientific research. And lastly, we're preparing for the vast relearning process needed when new treatments begin to restore normal brain function. We pride ourselves on our ability to leverage and multiply donations. Even in difficult economic times, the National Institutes of Health remains the largest funder of medical research. By making modest investments to promote their work, we've multiplied individual donations thousands of times over. Unlocking the secrets of Fragile X can lead to a cascade of treatments for potentially all developmental disabilities, including autism. Fragile X research has discovered the controlling pathway in the brain, and we now better understand its function. Fragile X researchers are sharing this knowledge with the world, and human clinical trials of breakthrough drugs are underway. The National Fragile X Foundation is effective because each member of our board is a parent who is invested with a sense of urgency in achieving our goals. Also, our staff includes more than a dozen full and part-time professionals who have a deep understanding of Fragile X and regularly interact with board members, parents, researchers, clinicians, and physicians. Finally, given the accelerated pace of scientific advancements, we are constantly updating our short and long-term objectives. This way, we know that we're moving forward every day toward a cure. We measure the federal dollars received by the entire community through our legislative advocacy efforts. We also look at the number of Fragile X specialty clinics and patients seen. 10 years ago, there were only a handful of clinics nationally. Today, there are 26 clinics nationwide, allowing more families to access needed specialists. Lastly, we track the level of support we provide. When that desperate newly diagnosed parent calls, we spend as much time as necessary offering help. Initially, that's hours, but for most, it lasts a lifetime. We still hear fragile what among laypersons and professionals. One big misperception is that Fragile X is not common, relevant, or important, when in truth, it's all of those things. For those who carry the gene, it's relevant to their entire family across generations. Another aspect not widely known is the inextricable connection between Fragile X and autism. Most with Fragile X are on the autism spectrum, and the Fragile X gene is one of the only known causes of autism. Autism may be an epidemic, but Fragile X is now viewed as holding the key to unlocking its secrets. The National Fragile X Foundation prides itself on clear and measurable success. We've developed a national public health program at the Centers for Disease Control devoted to Fragile X, and a medical research program within the U.S. Department of Defense. We work closely with the National Institutes of Health to grow their Fragile X research funding from $10 million to $30 million annually. And biannually, we host a unique international conference that brings together nearly 1,000 impacted family members, leading educators, researchers, therapists, and physicians to share the latest thinking, strategies, and scientific breakthroughs. We're proud of our scientific accomplishments and our culture of family and support. Fragile X was little known, poorly understood, and seen as a rare disorder, which makes it difficult to find new donors. Only 100,000 individuals have Fragile X syndrome, but as science has uncovered the wider breadth and scope of the condition and its close connection to autism, the number of those potentially impacted has ballooned to many millions. Once diagnosed, the condition potentially touches every member of the family, from children struggling with the effects of Fragile X syndrome to carrier mothers, fathers, and grandparents who can develop a myriad of symptoms, including cognitive, emotional, and neurological. Advocacy has been key to leverage